So when we talk about hemodynamics and the equation cardiac output equals heart rate times stroke volume, heart rate seems like the easier thing. But the thing about heart rate is that it is so variable, and its whole job is to try to compensate for the fact that the stroke volume isn't where it needs to be. My name is Leah. I've been a CVICU nurse for 18 years, and today we're going to talk through a little bit more about cardiac output. Cardiac output equals heart rate times stroke volume. Heart rate seems like the most base thing that we could talk about in that, because we know that in stroke volume, there's going to be preload, afterload, and contractility. The body wants to regulate itself to keep a good cardiac output. And we know that a normal cardiac output is 4 to 8 liters per minute. And we know we can index that down and we can get the patient's cardiac index. Cardiac index is just taking the cardiac output and dividing by the patient's BSA. So we're going to index it down to the patient's size. So if I have a really big patient or a really small patient, they need a little bit different amount of blood flow. Textbook is going to say that you need the cardiac index to be 2.5 to 4. A lot of times in our post-op cabbages and patients like that, we're just trying to get it above 2. Above 2, we know we can perfuse most organs, especially the kidneys, which are usually the first ones to take those hits. Technically, we want it to be above 2.5. If your patient is experiencing a decreased cardiac output and it's due to the stroke volume being low, then you're going to see your patient try to compensate by increasing their heart rate. That works up to a point. For a little while, that works good. In a healthy person, maybe even up to 180 beats per minute, that patient can still just chug along. But most of our patients, their hearts don't work great. They're CHF. They just had a heart attack. They've got a lot of problems. So in our patients that are sick already, they really are not going to be getting much compensation when they go above 120 beats per minute. We're going to need to think through if the heart rate is higher than would be helpful for compensating as a bedside nurse. What can we do to get that heart rate back where the amount of squeeze that we're getting is not too fast and we can compensate for the patient's cardiac output getting lower? So continue to follow this series and we're going to talk a little bit more about heart rate and cardiac output.